Hello, welcome to the Q&A session for the first webinar in our NDIS Success series, which was Success in the NDIS. Community Business Bureau acknowledges the traditional owners of country throughout Australia. We recognise their continuing connection to the land, waters and community, and we pay our respects to them and their cultures and to elders past, present and emerging. So my name is Jane Arnott. I'm the General Manager for Consulting and Business Services here at CBB, and I'm joined for the Q&A by Andrew Ellis, one of our business consultants. So we are trying to socially distance in a small room as we do the session for you. Thanks to those of you that have submitted questions to us over the last week or so. We'd also encourage you, if you haven't joined the Facebook group yet, to go onto Facebook, search for CBB NDIS Success, and join the Facebook group where you can post questions but also share your experiences. It's always good for providers to hear what other people are doing in this space. So we grouped our questions today into a few key themes. The first is going to be looking at how organisations are coping with COVID-19, obviously a very live topic for us. The second is about being new to the NDIS, and then we'll also look at some current issues. We did say on the last webinar, I bravely said that we would cover the quarterly review, the new data in this session. It was due last week, so it's due at the end of July, or in the last week or so. It hasn't been published yet, so the data that we used last time was up to March 2020. We're still waiting for the June 2020 data. So Andrew, I think you were going to kick off with the first question for me.
I do have the first question, and you get to answer it, Jane. So with all the talk about COVID-19, it would be remiss not to address that as part of this Q&A session. And I know, Jane, that you recently spoke at the Better Boards conference on how the not-for-profit sector is adapting to the impacts of COVID-19. So why don't we start off with you sharing with us about some of the key points of that presentation, and just help us understand what's happening in the sector with COVID-19 at the moment.
Sure. So the session I did was actually looking at the impact on the not-for-profit sector as a whole, not just disability, but I think there's some interesting points that we can pull out for disability service providers. So unsurprisingly, perhaps we saw that essential services had continued. So a lot of organisations obviously continuing to run those core services that people need, but obviously with increased infection control measures and with all the challenges that we're still experiencing with people having adequate access to PPE. Group work has gone largely online, so organisations that were doing group activities have either put that online, perhaps shifted some stuff into one-to-one sessions, or that work has stopped. So if they haven't been able to do it online or on one-to-one. One-to-one work, some of that's also gone online as well. So a range of different approaches there. From a back office perspective, I don't think it will surprise anybody to learn that everybody's tried to put their back office staff to home working, but that's also increased kind of paperless and digital working, so some improvements there as well. And people using some of the time, so where they've had time where they've not been able to do service delivery, using some of that to look at some neglected areas perhaps. So update policies and procedures, do some planning, rethink the business models, that kind of work. We've also come across quite a high reliance on JobKeeper. So lots of organisations are accessing JobKeeper, and obviously that's going to have some interesting consequences when that finishes and drops down. In terms of home working, I guess probably won't come as a surprise to many that a lot of organisations didn't have that well set up. So problems with getting people to work remotely, or even when they got people working remotely, the connections not being great, so it was quite slow. So I think this is an area that organisations are going to continue to work on. Obviously, our experience with Victoria is that we've moved back into lockdown with people working from home, and I think we should anticipate probably that we're going to be in and out of lockdowns for a while potentially. I think for those that are new providers, being able to start out making sure that everyone can work remotely would be a good step. Some of the issues that came through from home working was around isolation. So particularly organisations that where staff are dealing with some perhaps distressing or stressful client interactions. They don't have the opportunities to debrief around the coffee maker in the office that they normally would. So isolation being a bit of an issue there for people. But also some positive responses. So some of our client organisations are telling us that their participants have responded really well to going online, but also so they perhaps found it easier to engage online than they might have done face-to-face. But also clients talking about the impacts of doing one-to-one work. So one of our client organisations was saying that one of their participants had been doing one-to-one work rather than group work. This participant's parents were seeing the benefit to this gentleman of working on a one-to-one basis rather than groups, and went from 1 day of one-to-one a week to 4 days a week of one-to-one work. So, you know, real positive outcome there for the participant and for the provider.
I guess that's just one of many sticky changes that we're seeing with COVID-19. It's interesting to think of organisations who are doing more video conferencing or communication that way instead of travelling, but like that's a very real client change. That the pandemic has driven a different delivery model, and it's actually benefited that client and the parents and the family seeing the results of it. So.
Yeah, absolutely. I guess the other things we've seen is some workforce impacts. So a lot of people kind of picking up all available shifts, I think because of anxiety around you know, job security and those kind of things, but also seeing a loss of volunteer and paid workforce for those people that are perhaps in the higher risk groups for COVID-19. So they've kind of withdrawn their participation from the workforce, either voluntary or paid. I think we're also seeing now, in terms of people thinking about how they're going to respond to it in the long term, changes in the way that organisations are kind of structuring their staffing. So perhaps having people working in fixed teams, whereas previously you might have had people working across multiple shifts, working with lots of different colleagues, to try and reduce the impacts of you know, an infection on a group, to make it easier to do contact tracing. People are splitting their workforce into fixed teams that will only work with a certain cohort of clients, really to try and minimise the risk of transmission. And starting to see as well people, employers asking their employees who else they're working for. Obviously, we've got the nature of the workforce now is that people might work across more than one employer at any one time. So being able to track that again for a kind of contact tracing and reducing risk of transmission.
I think that's a very broad ranging description of all the changes that the sector has gone through, and obviously it's pretty unprecedented the times that we are living and working in, and disability is needing to respond to, and aged care is obviously needing to respond to as well. And you know, I know of one organisation, just as you've described it, that's gone through and asked every employee, over hundreds of employees, where else they are working, just to make that job easier if they do need to contact trace or if they do need to isolate people down the track. And I think that issue itself is getting airplay. I saw last week amongst the politicians that even National Cabinet, I think South Australia's Premier mentioned the two issues around aged care that are getting talked about at National Cabinet. One was PPE and the other was this issue of people working across multiple workplaces. And whilst aged care has been heavily discussed in the media and by the politicians, I think we're starting to actually see more and more disability get mentioned in the same breath, which is really pleasing to see, because the issues are still very, very similar in that neck of the woods. That's good. So we talked about all the changes going on at the moment, and obviously utilisation rates and things like that. There's still a lot of opportunity within the NDIS, and even I noticed in the first quarter of this year, from January to March, 30,000 new people came into the NDIS nationally, which is just a really significant number. So, Jane, you want to just, we've got a question here around, is it worth even considering setting up for the NDIS or growing your NDIS service right now, or should people just batten the hatches and wait a few more months before venturing into that territory?
Yeah, we've been talking about that quite a bit, as you know, Andrew, with the team. So what we're tending to find is organisations there's kind of two key trends in this area. So one is organisations really using this time to think about planning new services, and getting ready to launch as and when the risk of COVID-19 abates. Obviously, we can't be complacent again about that. We keep seeing the situation moving and changing quite a bit, but really using the time to plan ahead. The other we're seeing is increased demand for services. So organisations saying they're still getting services and have scope to expand, and that can be both existing service providers, but also some of the organisations we're working with have maybe funded under block contracts to work with a broader cohort of people, but they're recognising that within the clients that they're working with, they have people with disabilities that have eligibility for NDIS plans. So rather than them just providing those services under that block contract arrangement, is there opportunities for them to register with the NDIS and provide those services to those clients? I think it's particularly where they're seeing that the client group that they've got a mission to work with is not accessing or not able to access the full range of services that they need. So they're seeing that as their responsibility to step in. And I think some of that has been because other providers have withdrawn or reduced services, but also we know, we talked about it a bit in the first webinar, and I'm sure you'll talk about it more on the next one, that there's an undersupply of services at the moment.
Low utilisation rates really
yeah.
across the country. And I think I agree with everything you've just said there. And there's a couple of clients that I'm working with at the moment who, just carrying on business as usual with plans to expand their NDIS services. They haven't necessarily they're still in the planning phases. They haven't necessarily got to the decision of capital investment or resource investment, but I think you're spot on. We're still seeing organisations that are looking to that market and looking to continue to grow. Yeah, absolutely.
And you've been doing some work with organisations around merger as well.
Yeah, that's right. I've spent a few months working with some regional organisations that have amalgamated or merged together in the disability sector. And I caught up with someone at lunch today who was just talking about another merger or amalgamation of an organisation in the not-for-profit sector, not necessarily disability, though that's an element of the work that they do. And another organisation I know that's partially at least in the disability sector that's looking at an amalgamation or merger as well. So I think that COVID-19, in terms of the impact of that, I've seen some examples where, that even with JobKeeper and things like that and the government incentives, there are some organisations who've done it really tough. And it might be that the losses that, some smaller organisations have made in this time might be the last 5 or 7 years worth of surplus that they've managed to skimp and save away so that they can one day invest back into their organisation. And to see some of that equity drain away in a tough time like this and with still some uncertainty, I think some of those organisations are maybe asking themselves, can they afford to wait another 5 years to save that money to reinvest back in the business, or are they better off looking at, merger opportunities or things like that that might help them achieve the vision and the mission for the people that they're looking to serve, perhaps sooner. So JobKeeper certainly helped many an organisation in our sector, and even there are some other organisations. I know one of our other consultants has spoken about organisations who've maybe they're grant funded or other things like that, whose services have largely continued, and some of the benefits they've had financially from stimulus measures have helped them put more money aside. So they're actually coming out stronger financially and with more ability to invest. So I think it's an interesting dichotomy that some of those organisations are going to have, the opportunity to reassess, reinvent, grow themselves into the future as well. So I think that with the COVID situation, we are going to see a bit more merger and acquisition activity, and perhaps it just brings forward some of the things, the dynamics that maybe were slowly petering away in the background, but just brings it forward a little bit more at the moment.
Final point on COVID, price guide, NDIS price guide. Some more changes announced last week.
That's right. I think we're up to the 6th update of the price guide this year or something like that, but there have been some welcome changes made to the price guide, which will help support providers in Victoria and New South Wales up until the 30th of September, just while things are in the COVID type situation that we're in at the moment, I guess it's positive to see the NDIS that's responding to the need for providers in this sort of space. So amongst the price guide updates just recently, well, there's extra funding for PPE for workers, funding for PPE for participants, cleaning services for participants in Victoria if the worker attends the participant's home and then later test positive. There's support for participants who are required to self-isolate or quarantine, so that's short-term accommodation support. And there's also additional SIL supports for participants who have to self-isolate or quarantine.
Yeah.
And a once-off deep clean and additional short-term accommodation is needed there. So, providers and NDIS participants should discuss and agree on any pricing changes before they're applied, obviously. Might need changes to service agreements or variations and things like that. But there's some opportunity there for providers to be able to utilise those extra categories and changes within the NDIS price guide. Yeah.
Cool. So we've had some questions in from people that, NDIS is new to them. So maybe if we kind of look at some of those, and I know you've spoken to someone recently in that category. So, new to the NDIS, not sure where to start. What did you discuss with your client that called you the other day?
Yeah, so I had someone ring up the other day who was wanting to enter into the NDIS, had a business with services in other industries and was looking to get into the NDIS. And, it can be quite daunting to, look at this big $20 billion a year scheme and to think, where do you even begin? But I think having taken that phone call just recently, I think it was really pleasing that we've got this program on at the moment. And so obviously that was one area that I suggested this person start with, because I think the NDIS Success Program and this group of 6 webinars is for organisations and for individuals who take the time to watch all of them, to go through the Q&As, to submit their own questions, to use some of the exercises and the resources that we've provided. I think you'll come out of the next 10 weeks or so with a much better idea of where you want to go with your NDIS business. So yeah, we get that it can be quite overwhelming for people who are new to it, but this program really is a great resource that will help with that. And I think more than that, and we'll touch on later about other sources of data and resources that are available. But if you can spend the time to go through the NDIS website and the Quality and Safeguarding website, there really is now a wealth of information there on many different topics that can help providers to figure out what they need to do. Those sort of resources are designed to provide you with some structure to help you research and learning about the NDIS. And I think, there's just a lot of value in all of those things. So there's probably no easy answer. There's no silver bullet. It's not like maybe it would help actually if you hired the right resource who had some experience as well. If that's if you're trying to get into the business new and you're really sure of making that commitment. But aside from that, nothing takes the place of hard work, with anything in this world. And I think that the time that you spend in it will be worthwhile as well. And we see that in clients. I know that Ellen, one of our other consultants, deals with is figuring out the right headings under the price guide to charge under, and spending the extra time to learn and to understand things like that gives extra revenue streams for organisations when they really understand it and get it right. So, my turn to ask you a question, Jane. So what new businesses have we seen as a result of the NDIS? Yeah,
really interesting. So we've been working CBB in the NDIS space since 2014, since it was first piloted. And I guess we've seen, work with, well over 100 organisations in that time frame, and come into contact with many, many more. So I think, the NDIS has created 2 new types of business, entirely new in terms of, support coordination and plan management. So those are kind of really new areas. We've also seen people in allied health, so break out either into their own businesses, or maybe they've already got practice and then they decide to deliver it to NDIS participants as well. behaviour support specialists, and then also support workers. So people that have perhaps been working as support workers or in, students and people like that, going in and offering personal support and social support, either in terms of setting up their own business or through models, particularly for students and young people, through models like Mabel and Higher Up, where they can go and just do some shifts working with a person with disability. I think what's been really interesting about the NDIS is some of the things that we've seen is the number of people that are going into new NDIS businesses who've either worked in the disability sector themselves, so they've got a lot of experience, but they want to be able to work in a kind of leaner way and work directly with clients on that basis, but also a lot of people with lived experience. So a couple of the support coordination businesses that we know quite well, have been set up by people who've had a family member with a disability, and they've experienced firsthand some of the challenges of them navigating the process and accessing services.
Yeah.
So I think lived experience as a carer has been an interesting one, but also people with lived experience of psychosocial disability, for example, setting up as peer support workers in that kind of space. So there are a lot of opportunities still within that market.
And still a lot of growth.
And still a lot of growth, which is, some maybe perhaps you can talk about some of the growth that we've seen in the sector.
Well, I think there's been growth in all those areas that you talked about, and still continuing need, and even in some of the I forget whether, I think it was plan management. I was reading in the previous quarter's report just the growth in recent quarters in services like that, early on in the NDIS, it was just a third between between participants being, self-managed, plan managed, or agency managed, and now that plan managed is increasing.
Quadrupled from its original level, or from its level in 2017 or something.
That's right. So it's increasing more than those other areas. There's been also business growth in SIL, in personal care, social supports, people selecting one-to-one supports more. And I think you've given some examples of that already in a conversation. And some of the growth has been in organisations that have really honed in on their target market. We've seen that, a specialisation around the type of disability or particular type of service. Organisations that are like the Higher Up or Mabel model that are very dedicated to that type of service, but then other organisations who might just be focused on a particular type of disability and have had the ability to grow and expand the range of services that they provide. So we're going to talk a lot in the next webinar that I'm sharing in a week's time about being market driven and understanding your target customer segments as well. And I think that'll help really hone this point in some more about the business growth that's there.
Cool.
So we've got another question from someone. I now have a better understanding of what's required to be a registered NDIS provider. Wondered if you've got any estimate of what the cost of registration will be, and especially when starting out and then annually. Yeah, we get asked this one a lot, and it's one of those horrible answers that I give, which says it depends. So we talk about this in webinar 4 in the series, where we'll look at quality, risk and compliance issues. But essentially, the cost of registration will depend on a variety of factors. So it could be anything between $2,000 to $10,000. And it really depends on the registration groups, the complexity of supports that you're offering, the number of different outlets that you have, so where you're offering those supports from, and the number of participants you're currently working with or you anticipate that you will work with, and where you're located. And essentially what happens is when you register, you could submit your initial form to the NDIS Commission. They come back with a scope of audit, which basically says these are the things that you will need to be audited against in order to register, and you take that to an approved NDIS auditor who'll give you a quote. So it's difficult to give a kind of standard figure, but that will give you an indication.
if you haven't started that process yet, you could always ring one of those approved auditors, and they're listed on the Commission website, and just say, these are the registration groups that I'm looking at. This is the kind of number of services I'm expecting to provide in terms of outlets and participants, and they might be able to give you an idea of how much it will roughly cost. So if you're at that very early stage trying to work out your budget, that might be a way to do it.
Yeah, that's good. So we're going to move on and talk a bit about current issues now. There's a few different current issues going on in the disability sector. We've seen the tragic situation here in South Australia about Anne-Marie Smith recently, and just last week her carer has been charged with manslaughter. And I know there's been a couple of other, same but different incidents in other states as well that have really been quite troubling, challenging, tragic in the situation as well, not unlike that. So what impact do you think this case is going to have on disability service providers and on the NDIS?
So, I mean, this is very much still an ongoing situation. So to say, the paid carer was charged with manslaughter last week. I believe the South Australian Police are still investigating potential for other charges, and there's inquiries and commissions and all sorts of discussion going on. So I think how it changes will evolve over a period of time. I think one of the things that certainly when we started reading about this jumped out at us was that Ms. Smith needed care every day, and had one person that was going and providing that care. Now it's not possible to really manage the quality of care if you've just got one person going in. Theoretically they're there every day. So how does that work with annual leave and weekends and sickness and all those kind of things? So there was some warning signs there from a management perspective. So I think it was a situation that kind of left an open door really to abuse or neglect, because you just have that one person. You wouldn't leave one person solely in charge of your financial situation. So you don't do that with a participant either. So I think there'll be some immediate lessons for providers in terms of rostering and supervision of workforce. So making sure that you're not dependent upon just a sole person to provide care, and that there is effective supervision. I think there's also some interesting discussions to be had around advocacy, and I know that that's an area that the South Australian government has identified that they will put more resources into in response to this, but really ensuring that people that are receiving services are able to raise concerns, that they're supported in raising those concerns, that if they're not able to articulate for themselves, you've got a means of ensuring that the quality is good, and that there's no risk of retribution, and that they're supported in getting resolution for those concerns. I think we need to look at this in the context as well of the Disability Royal Commission. So there'll obviously be recommendations that come out of that as well. So I think we can expect to see changes around quality and safeguards in the longer term, and hopefully more funds available for advocacy, so that people with disabilities are able to raise issues.
That hasn't been well funded really before.
It's not been and it's not included within the NDIS. So people are, or hasn't been included hitherto within the NDIS, so it does leave people very vulnerable, I think. One of the other things which is kind of COVID related, but beyond that, is and a total change of theme, just in terms of how you run your organisation, is that we talked a bit about when we were talking about COVID around people moving to more digital forms of engagement. You're starting to see, so you're a member of the Australian Institute of Company Directors, you're interested in that governance space, you're starting to see some stuff around electronic AGMs and those kind of things. So maybe if you can talk a bit about that as a current issue in terms of moving to more electronic governance and management of organisations.
Absolutely. And I think, Jane, you're on the board as well, so you've seen board meetings go electronic, and reporting through to the CBB board as well. You've seen board meetings done via Zoom or equivalent, similar equivalent technologies, and Yeah, I think I've been part of a couple of AGMs now that have happened through technology. So many organisations are going that way, and I think, just as I reflect on, we were talking before this started about some of my experience working in sport previously, and we have members that are spread across the state, or perhaps organisations spread out more broadly than that, we haven't historically, I think, as a sector or as governance professionals or boards, done many electronic AGMs in the past. So it's interesting that COVID's forced us to do some things that maybe we weren't doing previously, and some of these things I think will stick. So yeah, I think there's a number of organisations going through annual general meetings through electronic means, and it's, I guess, within each organisation's context, you need to check that the Constitution enables you to do that. And most modern constitutions, I think, would be written in a way that enables meetings to happen via technology, and there's sort of some standard language that often gets used that's fairly broad ranging in terms of how it's written. But in terms of that, there's also been legislative changes from the government that's enabled more of that in recent times. And I think if people are interested in looking at it more specifically, I'd suggest have a look at your constitution, and also the AICD website often have articles, or the Governance Institute as well similarly have resources available that will help organisations with that. Cool.
Yeah. So last question, kind of quite a good wrap-up question, and you've mentioned some of this already, but where people are feeling a bit kind of, I need some more information, advice, where can people go to get more information and good quality information about
good quality
NDIS?
Information? Well, I think our website would have to be a good starting point to suggest as one of those options. And I think this CBB NDIS Success Program, these set of webinars, I think, are a great resource for people. So we'll start off with our own plug first, perhaps, but we also have a blog every month that goes out called Forward, which you can find on the homepage of CBB's website. And we have 4 or 5 articles each month that are relevant to the sector, not-for-profits and disability, talking about different key issues and themes at the moment. But more broadly, the NDIS website, the NDIS Quality and Safeguarding website, I guess is one sort of part of that. There's, we've touched on at the beginning, the quarterly reports that come out. It's just a wealth of information. Every time you dive back into them, you find something new and different insights to what's going on in the market. So I thoroughly recommend those. And our peak body, or different peak bodies around, National Disability Services, or NDIS, have some great resources as well, and events and training and things like that you can look at. And notwithstanding all of that, the state government health departments, some of them also have some terrific resources, and particularly around COVID. And I wouldn't necessarily restrict yourself to looking at your own state on that. That sort of resource that's freely available, you could easily look at interstate resources, and you'll find good ideas in amongst all of those as well. So I come back to what I said before, that you can't skip through this really quickly. You'll get the benefit if you spend some time digging and looking and reading and considering and meditating or chewing it over, that sort of thing, to reflect through those resources.
And a really good point to look at resources from different states and territories as well, because certainly in the COVID context, we have staff that are based, our head offices in Adelaide, but we have staff based in other states and territories as well. So when it comes to looking at what the COVID restrictions are, and our clients are all over the country, we're frequently looking at other states and territories to see what they're advising, what the requirements are, etc., etc. And similarly, when we've done work around the NDIS and supporting organisations to transition, quite often state governments have funded different organisations to provide support to the sector, and some of those resources are freely available online, so it's worth looking at what different states and territories have got out there as well.
Absolutely.
Cool. So that's the end of our questions for today. Thank you for watching and for joining us in this session. Do pop onto that NDIS Facebook page and drop some questions in if you'd like us to address anything in future Q&As. Andrew will be presenting our next webinar, which is on understanding the market. So really looking at the market context and the competitive space and understanding who your target customers are and what your growth opportunities might be.
Absolutely.
And all of that really good stuff that we've done a lot of work around with our clients.
Yeah.
That will be available on the 18th of August with the follow-up Q&A on the 25th. So thank you very much for joining us, and we will see you next time.
Thanks for tuning in.
Cheers.